Hi, good afternoon, everybody. My name is April Kane from the Regional Response Health Collaborative Program. Here locally in the southwest and northwest areas of the state, we call it the Western Pennsylvania Regional Response Health Collaborative Program. This program has come out of partnership with the state of Pennsylvania through Act 24 legislation that was signed by our governor on May 29th. The initial funding period of this program is July 1 through December 1st of 2020. However, recently the state has extended the program for an additional 30 days to end on December 30th of 2020. The purposes of the Regional Response Health Collaborative programs is to provide long-term COVID support services to our long-term care facilities. And when the state designates long-term care facilities, they are focused on assisted living, personal care homes, and nursing homes. They had initially awarded 6 different regions in our state. And as I said, we are in the southwest and the lower half of the northwest corners of the state of Pennsylvania. This partnership, our operating partners here are UPMC, Allegheny Health Network, the Jewish Healthcare Foundation, the Healthcare Council of Western Pennsylvania, in addition to having regional healthcare partners through Excella Health, St. Clair Hospital, and Penn Highlands. Over the course of our region here, we cover approximately 600 of these facilities that are designated as assisted living, personal care homes, and nursing homes. The purposes of the Regional Response Health Collaborative is to be able to provide supports to these long-term care facilities, and we are doing that in a number of ways. We currently have a 24/7 call center where facilities can reach us and ask questions that they may have related to testing supports or infection control. We are responsible for conducting infection control assessments and providing support and guidance to facilities if they request our supports, and can provide information and direction through the guidance also from the state of the PA-HONS, helping to interpret some of those practices in real-time education and effort within your facilities. We will also be responsible for providing rapid responses to facilities for infection control assessment if called upon due to notification of an outbreak. We also provide additional crisis support and coordination related to emergency PPE use, as well as emergency staffing or the utilization of an alternate care sites. Our partners at the Healthcare Council of Western Pennsylvania, they provide key forums of discussion amongst the various facilities under our initiative, and they also help with PPE assessment from when we send out information. When we send out a supply of PPE to facilities, they also help follow up on what other streams that people may have for supply distribution or needs. The Jewish Healthcare Foundation does also help us with facility supports and services related to educational online forums. They hold bi-weekly educational webinars for the skilled nursing facilities as well as the assisted living facilities. But today, we are here to talk a little bit about how we can take care of ourselves better at this time dealing with a crisis. So we know that taking care of ourselves and supporting our colleagues are very important aspects of managing the COVID-19 pandemic. Today is our 3rd webinar session. During these live sessions for long-term care facilities, we're providing more information about normal reactions to stress, healthy coping strategies, and how to help foster personal and organizational resilience. We are doing this today in partnership with the Allegheny County Health Department and the UPMC Western Psychiatric Hospital's Critical Incident Stress Management ASAP staff support team. At this time, I'd like to take a pause and be able to introduce Dr. Kristen Mertz from the Allegheny County Health Department, and she will be providing a current assessment of COVID in our region.
Thank you, April, and thanks to everyone for joining today. As you know, long-term care facilities have been hit very hard by the pandemic. In Pennsylvania, we have approximately 300,000 cases reported in the state so far, and in the Southwest District, over 48,000 cases reported, and in the Northwest District of PA, over 12,000 cases reported. And of those cases, long-term care residents and staff make up about 13% of all the cases. But for deaths in the Southwest, we have almost 1,000 total deaths, 981, and in the Northwest, 176 deaths. But of those, over 2/3 are long-term care residents. So most people dying in our region are long-term care residents. And we realize that dealing with illness and death can take quite a toll on staff. So the difficulty of doing an already hard job is compounded by the pandemic with the added task of caring for ill residents, trying to protect all the other residents and staff from getting sick, and the endless documentation and reporting requirements that you have. But despite all the stress and long hours, we've really seen an amazing number of staff who've worked all day and night to control the virus in their facilities and end outbreaks. And we are very grateful to you for your dedication and your perseverance. But all the stress can take its toll, and we recognize that it's important to seek support and to encourage staff, your fellow colleagues, to seek support. So the objective of this webinar is to share info on resources that staff can use to receive support. So thank you again for joining us and for all that you do. I'm going to turn it over now to Jeffrey McGill from the Western Psychiatric Hospital. Thank you.
Thank you, Dr. Mertz, and good afternoon to all of you, and thank you for your time this afternoon. Also, a thank you to April Kane and the good work that they are doing within the UPMC Western PA Regional Response Health Collaborative. It's a great partnership to be able to be a part of today and to be able to provide some support. So as Dr. Mertz indicated, my name is Jeff McGill, and I am the co-manager of the Critical Incident Stress Management Support Team at UPMC Western Psychiatric Hospital. I, along with other members of our stress management support team, will be presenting to you today what we call a crisis management briefing. This briefing is designed for you, our healthcare team members at our long-term care and our skilled nursing facilities that have been impacted by this pandemic known as COVID-19. Our goal is to provide tools and resources to help manage the stress impact that the individuals and organizations have experienced over the last 9 months related to this pandemic. This crisis management briefing will help address the following, including stress reactions, coping tools and wellness approaches, resources of support, as well as talking about organizational resiliency. I want to begin by saying that our support team is certainly saddened by the toll COVID-19 is having on all of our long-term care and skilled nursing facilities. We know that the individuals in these facilities, due to their age, their health conditions, their communal living status, are among the most vulnerable to get sick and even die from this infection, unfortunately. I would add that the stress toll that this pandemic has had and continues to have on all the members of our healthcare teams are great. As you heard earlier, over 300,000 cases of COVID-19 in Pennsylvania, with 48,000 of those cases occurring in the Southwest and another 12,000 in the Northwest portion of our state. It's estimated across the United States that as much as 35% of all deaths affiliated with COVID-19 have been occurring in our nursing and long-term care facilities. So as a result, we recognize the impact this pandemic has had on each and every one of you. During this pandemic, healthcare team members were often the only support, as family members and loved ones were not able to come to the facility to have in-person visitation. Family members would often ask healthcare team members to be at the bedside of the loved ones and to support them both in their physical and emotional care needs. The cumulative stress, both professionally and personally, I'm sure have left the workers within our long-term care and skilled nursing facilities with a great need for support. It is our shared hope that today's briefing can really help engender and enhance individual and organizational resilience as you look to restore adaptive functioning to this pandemic, and that this briefing in some way aids you as the healthcare team members in your journey of wellness and stress management. As we've previously stated, this impact on you is very much noted. To discuss the range of impact, I'm going to now turn it over to Kelly Mullen to talk a little bit about stress reactions. Kelly?
As Jeff said, my name is Kelly Mullen, and I'm the program manager of Pathways Long-Term Residential Program here at Western Psychiatric. Our program serves 16 patients with mental health disorders, and it is a residential program. So we too are faced with caring for patients long-term. Unlike other critical events in our lives, the COVID-19 pandemic has lasted much longer, for many more months than any of us have anticipated. This has tasked our abilities to manage and cope. As healthcare workers, we are faced with extraordinary times, including high work demands, challenging personal and professional stressors, and pressures to find a work-life balance. COVID-19 is stressful because it's outside the range of normal day-to-day experiences, and we may feel we have a lack of control in the situation. I'm going to review common stress reactions. We know that the intensity and the duration of exposures to stressful events can lead to more intense and prolonged stress reactions. As such, the pandemic is different than many other acute adverse events. It is normal to have these stress reactions, as they are the way our mind and body are coping to our circumstances. If these are interfering with our quality of life, we can reach out for additional support. We see the resource sheet. Below are the common stress reactions that may occur. I'm going to first go over some emotional responses that you may be feeling. Many of you and us are feeling a lot of fear. You may be feeling fear about getting the virus yourself. You may be feeling fear that you may bring the virus to the patients that you're serving. You may be feeling fear that you may bring the virus to the loved ones that you live with in your home or family members. You may also be feeling fear of losing patients within the facility that you're working at. You may be feeling a lot of guilt about, again, bringing this virus home, not being able to be with family members because of having to work longer hours at the facility that you're working at. You may be feeling a lot of frustration. You may be feeling frustration that you're not able to have the individuals that you're working with see their family members. This might be very upsetting for you. Maybe also feeling frustration that family members don't understand that they can't see their family members, and they're taking their frustrations out on you. You may be feeling a great deal of anxiety, just not knowing how long this pandemic is going to last. You may also be feeling a great deal of anxiety, not knowing what to expect on your upcoming shift, not knowing what changes you may be faced with within your own family system, with school and school needs, with your childcare needs. Maybe you're having anxiety with financial strains within your family. Maybe your partner has been laid off, maybe due to childcare and having an additional expense. Also, just the anxiety of how long, again, that pandemic is going to last. You may be feeling a great deal of anger. Maybe anger due to having longer hours, having to do additional shifts, due to having call-offs at work due to COVID and people calling off with having symptoms. Maybe anger towards coworkers who are not abiding by some of the rules that have been imposed about they're not doing the social distancing. Maybe they're attending family gatherings that are larger and keeping themselves at risk, and you're aware of that. You may be also feeling a great deal of sadness from the loss of individuals that you've been working with, the loss of seeing family and friends, just the overall loss of normalcy. We often don't acknowledge this loss, and we don't acknowledge that we're grieving that sense of normalcy and what used to be. Next, I want to talk about those cognitive responses we may be experiencing. We may be having intrusive thoughts about the pandemic, about the individuals we had worked with and them experiencing the COVID and what they had been impacted with the virus. You also may be hypervigilant right now, being on edge, having easier startle responses, hypervigilant about how you are using your sanitizer on your hands and just being hypervigilant everything that's going on around you. You may be experiencing memory problems, have a harder time recalling time, what's happening recently, maybe more forgetful, recalling tasks, can be experiencing changes in the perception of time. You may be also experience a decrease in concentration. These are all very normal things to experience during these times. Can you go to the next page, please? Thank you. Some of the behavioral responses you may be experiencing is you may be feeling like you're more easily agitated, more irritated by things that usually do not bother you. You're having increased personal conflicts and professional conflicts on the job that you used to not have. Your sleep patterns have been impacted. Maybe you're sleeping more or less. Appetite changes have occurred. You may be eating more or less. Another common behavioral reaction is increased use of alcohol or other substances. Some physical responses that are common may be fatigue, nausea, dizziness, headaches, increased heart rate, sweating, grinding teeth, feeling of shortness of breath, insomnia. And lastly, I want to review some spiritual reactions. Maybe you're feeling some anger at God or a higher power, having some crisis in faith. Maybe you actually are turning towards your faith during this time, and that's a sense of peace. You may be withdrawing from your faith-based community at this time. Maybe a disruption of the meaning of your faith, feeling hopeless or helpless, loss of trust, feeling isolated or alienated. Next, I want to talk about the recovery. All healthcare workers facing acute stress reactions can fully recover and may thrive afterwards. We know that the response of the organization and agency has a strong impact on how people recover afterwards. We encourage using the tips and resources handouts. Prioritizing your well-being is key in continuing to provide excellent individual care. I want to take this opportunity to thank you all so much for what you guys do every day and the work that you provide to the patients that you're caring for. Thank you, and I want to turn this over to Jeff.
Thank you, Kelly. I appreciate that information on our stress reactions. As illustrated on your screen, next we're going to talk about coping and wellness. And so as healthcare team members, we know we face extraordinary times, including high work demands. We're faced with challenging, both personally and professionally, in terms of stressors and pressures to find a healthy work-life balance. And I'm sure over the last 9 months, it's really been extremely challenging to find that balance. I would say that most of us are creatures of habit. We love familiarity, and certainly COVID-19 has pushed all of us outside that range of normal, or what we call typical, day-to-day experiences. So as a result of this COVID-19, we likely has led to feelings of a lack of or a loss of control. So Dan Litchak and I are going to talk about the importance on focusing ourselves on coping and wellness and the tools that we can do to help regain a sense of control during these most unusual times. So we're going to go forward and begin to talk about ways we can support ourselves in the beginning. So this handout titled Coping and Wellness, you'll find many recommendations. We're just going to highlight just a few of them that we find to be very meaningful. As we heard previously, stress often manifests itself in the form of fear and anxiety. We know this is often due to a lack of information, rumors, or misinformation. And I think we would all agree when you turn on the news at night or during the day, there's a lot of information out there about COVID-19. Not all of it is truthful, and some of it's based on misinformation. Some of it's used to produce a reaction, a response, or create controversy, or look to break down science. To that point, we would recommend that it's vital for all of us to truly understand the risk, to stay informed, and to be certain that we're getting the facts from the trusted and reliable sources. I think it's all of our responsibility to stay up to date on what is happening while really trying to limit the amount of time we give to media exposure. And I know finding that balance can be really difficult, especially in today's world of social media, where every time we turn, whether it be on our television or other media devices like our phones, there's information out there. We would recommend not only limiting the amount of media exposure, but also just thinking about who you follow and what information and where you get that information from. So following credible and factual sites can really help reduce the anxiety while keeping us informed. Making a purposeful effort to limit the amount of time you spend focused on COVID-19, especially outside the workplace, is really important to help find that balance between work and our personal lives. We'd recommend that you follow the UPMC COVID-19 page as a way of staying informed about healthcare and to stay connected to the County Health Department's COVID-19 webpage for current and local and regional updates. Next, we're going to encourage you to speak up. I think one way that we can take control back is to continue to be a voice for ourselves, for our patients, for our organization. So it's important that we advocate for our needs. And events such as this pandemic can really leave us feeling helpless or powerless due to this loss or a lack of control. With that being said, it's really important to have a regained sense of control, for which can occur by speaking up and having a voice. Ensure you have what you need to feel comfortable. Again, continue to advocate both for yourself, for your patients, as well as the organization and your needs. To also address those feelings of helplessness or powerlessness, it's important that we feel more comfortable by staying connected with our support systems and our connections. And I know there's been so much focus on social distancing during this pandemic response, and certainly social distancing has really shown to limit the exposure risk and to reduce the transmission of this disease. So it is still vital that we do socially distance, yet it is vital that we do connect with others. When we experience difficult times in our lives, staying connected with our supports is so vital. And I know as we approach a holiday season, whether that be Thanksgiving, Christmas, Hanukkah, Kwanzaa, whatever that is that you celebrate, we know that it's often with friends, families, and support. We know it's so meaningful to have those connections, and we're encouraging those connections. We just ask that folks do it very carefully, with great consideration, and following the recommendations that are out there and in place. Consider those who you turn to when these bad things happen in your life. Who are those that you can see as a support that is trusting and supportive of your needs? Identify those individuals and reach out to them. Really share openly your concerns and how you're feeling with those friends, family members, and loved ones. Try to maintain those healthy relationships, and although it may not always be in person, oftentimes it's through the use of our social media platforms like our Teams, our Skype, Facebook, etc. That we can still do those meaningfully and with great purpose, while allowing us to truly maintain that social distancing. Allow your supports to be a healthy distraction from the stress of COVID-19, which could really add a sense of normalcy and familiarity in these trying times where very little seems to be familiar or typical. Additionally, I would say having a real positive attitude or outlook can help us navigate through these trying times. I think for most of us, when we hone in that portion of ourselves where it's the glass half full attitude, we realize that we have a lot more controls than we may initially perceive. Trying to maintain a sense of hope and positive thinking really allows us to be more resilient through these difficult times. I think it's easy to get down, to start to focus on the negative, to experience a complication of this loss of control, loss of familiarity, and feel defeated each and every day. Yet at the same time, if we decide that we're going to take this on, we're going to be positive, we're going to find those silver linings, we're going to make those connections and do it in a way that allows us to keep a positive outlook, oftentimes we feel a sense of control once again. So consider those aspects of your life that you do have control over. Instead of just focusing on the negative or the areas where you feel powerless, think about those that allow you to feel less helpless to and more control of. Consider that phrase, mind over matter, as it truly can be helpful in providing that sense of control once again. So next, I'm going to turn it over to Dan Litchok, who's going to discuss how best to support others, including your family and patients. Dan?
Thank you, Jeff. My name is Dan Litchok, and I'm the co-coordinator of the ASAP team at Western Psychiatric Hospital. When we go to provide support to others, we want to be able to take the time and the opportunity to focus on the people that we are providing that help and support to. When others reach out to us, just for a listening ear or maybe some advice, one of the biggest things that we have to do is first and foremost, we have to be able to listen to those individuals. Too many times we start thinking about the situation and then the different ways that we can correct it or we can fix it or we can mitigate that problem for the people that are asking for our help and our support. But more often than not, in reality, what they're really looking for is somebody to be able to just listen to them and to be that listening ear. When we take the time and the opportunity to be that good listener, we have the ability to then go ahead and to start to empathize with the person that's telling their story. And when we are able to be empathetic in that way, we can do one of the biggest things that any human being can do for another, which is to be able to validate that person. When you're able to validate your coworker or somebody else in your life about how difficult their day was, how stressed out they are, how overwhelmed they are with working from home or working out in the community, or the different responsibilities and job tasks that we didn't have in our lives 9-10 months ago. And to be that listening ear and to sit down and listen to that person and provide that empathy and validate them and have that person just come to the realization that you are a person that actually truly listened to them. When you are listening to them and you're providing that validation, we also want to make sure that we reaffirm with the individual that what they're experiencing is okay, that these are normal reactions to something that none of us have ever experienced before in our lifetime. But those reactions doesn't mean that there's anything wrong with the person, but it's just a typical reaction to something that they're experiencing. More often than not, like I said, people just want to be listened to and they want to be heard. We're not there to really try to fix the individuals, but we're there to be more of a support to the individual. There's a big difference between fixing and supporting. More often than not, the fixing comes from individuals that are, have a different speciality than what we do. But we're just going to be there to listen and support our coworkers and our loved ones. At times, if you realize that the person that you're talking to and supporting could use some extra support in the realm of getting some things fixed, then we would, the most appropriate thing that we could do for those individuals is to refer them to individuals, the professionals and the non-professionals that could help in those manners. When we have these relationships with our friends and with our coworkers, and we provide that support, we also want to recognize that it shouldn't just end when that conversation ends. But one of the best things that all of our relationships have in our own lives, our professional relationships, our personal relationships, our intimate relationships, is there's maintenance to those relationships. So checking in on the person that was telling you how difficult their day was, just to see how they're doing a couple of days later or a week later. It doesn't necessarily have to be a face-to-face check-in. It could be done over the phone or through a quick text or an email or something, some other form of communication where we have the opportunity to provide that extra level of support to say, hey, you told me about something that was bothering you, and I'm here, I'm still here for you, and I'm just checking in to make sure you're okay. When we have the opportunity to provide a little bit of verbal support, we want to be able to talk about the different ways of making sure that our friends and our coworkers and our loved ones are taking care of themselves, different ways that they've mitigated some stress, by disclosing some ways that help you reduce some stress, or some things you might have heard a coworker do to reduce some of that stress. The more opportunities and ways that our friends and our family and our coworkers have to help mitigate some of that stress, the more tools that we can put into that toolbox, the better off they can be. When it comes to providing help and support to our families, those that are most close to us and the most intimate to us, we want to be able to make sure that we make time for them. And one of the easiest things to do is to step away from our screens. So maybe it's, putting our phones down, closing the laptops, stepping away from the TV, and being able to enjoy each other and for the people that we are, engaging in good conversations, engaging in conversations that are along the lines of how we would support our friends and our coworkers that I just previously spoke about. Sometimes it's a lot easier to do around a dinner table, or around the table where you have the opportunity to play some games where we're not focusing on a screen and fully distracted by the screen, but we're distracted by the conversations that we're having with our loved ones at those times. Sometimes it's okay, to reach back to the screen, but maybe more, let's sit around the living room and let's enjoy a show that we like to watch. And with the holidays coming around and all of the different holiday shows, maybe that's an opportunity for a time for us to reconnect. Or maybe it's watching a special or favorite movie that the family likes to do. Sometimes your family might ask you how you're doing and how is that they can best support you. Tell them. They're asking to be an advocate and a help and a support for you. Then tell them what you need. Tell them that you need some time and space alone, or you tell them that you need somebody to just listen to you, because they're going to be just as there for you there as much as you are for them. And then any opportunities, at least while the weather is still okay, and sometimes when the weather is not as warm as it has been, getting outside with your friends and your family and doing activities outside is a great reinforcement of being able to reduce some stress, but also do it in a setting where you're together with your friends and your family. So I'm going to pass it off to my colleague, Michael Edestein, who's going to continue to talk about the different resources available.
Thanks, Dan. Good afternoon. My name is Mike Edelstein. I'm the Manager of Behavioral Health at Western Psychiatric Hospital's Emergency Department, as well as the Resolve Crisis Services Program. I'm going to talk a little bit to you today about some resources that hopefully you'll find helpful. One of the most important ways that we can help people to feel supported is to link them with resources that they can access during particularly challenging times. We're somewhat lucky in Pennsylvania in that we have resources available to us that are very accessible. In fact, many of which provide services 24 hours a day, 365 days per year. I want to briefly orient everyone to some of these resources, which can be very helpful even long after today's crisis briefing has concluded. So first of all, I'd like to talk about a great resource. It's called the National Suicide Prevention Lifeline. This resource is a national network of local crisis centers. Free and confidential services available 24 hours a day, 7 days a week. It's a resource that's always accessible, serves the country, so you can receive support anywhere. Support's available for people experiencing emotional crisis or suicidal thoughts. So don't let the National Suicide Prevention Lifeline title, stop you from reaching out to them if you do feel like you need support. Services can be accessed through the 24-hour phone center or online chat or text services. You may be able to link with local resources by your conversation through the person with whom you're speaking, since it is a network of local centers. The next resource I'd like to point out is known as the Disaster Distress Helpline. This resource provides counseling and support both during and after disasters, and for sure, COVID-19 falls into this category. This service has specialized knowledge about disaster-related follow-up care and resources, and specific COVID-19 resources as well. Not everyone likes to access services through the telephone or even through a live provider, in this day and age, especially some of our younger people are particularly, averse at reaching out through a crisis text line service. Some people may be more comfortable reaching out for emotional support in this manner, especially the younger consumers of crisis services who are more accustomed to doing so. PA's new support helpline is also a resource that you may find helpful. It's administered by the Department of Human Services, offers support and referral helpline to assist anyone challenged with anxiety or other challenges. During times of stress, some people may find that they rely on substance abuse as a way to cope. The Department of Drug and Alcohol has programs that can provide support for people struggling with this challenge. It may be especially helpful for those that may be tempted to use alcohol or other substances as a way to cope, particularly during this uncertain time, and they can help you find DNA supports and providers that are online, so you may be able to continue with support programs such as 12-step programs. They will actually stay with a person on the line until the caller is linked with a treatment provider. This service is very accessible. It can be accessed through phone, text, or even chat. Veterans tend to have very specific special needs when it comes to crisis, and the Veterans Crisis Line has been established in recognition of this. Veterans have, for many years, been able to reach out for their emotional support with people who truly understand the special needs that veterans do have. Suicide prevention is a focus, but the Veterans Crisis Line also supports general emotional support to veterans. It's accessible via telephone or online chat. Prevent Suicide PA is another suicide prevention service. It provides support for those affected by suicide, provides education, and targets the reduction of stigma associated with suicide. It can also provide resources for special populations such as healthcare providers, military members, first responders, survivors of suicide, and parents and caregivers. Please feel free to take advantage of these valuable resources, most of which are available 24 hours per day, 365 days per year. Please also consider referring these services to coworkers or other people similarly affected by the pandemic. Now I'm going to turn it over to Abby, I believe.
Yes, thank you so much, Mike, for the information on the resources and everybody for sharing the information that we've heard so far. I really encourage everyone to review and utilize these support networks, both in addressing the stress related to this pandemic and in general. I know personally that I have utilized these tools and have had to take several steps back and deep breaths in just managing my own stress through this pandemic. We're going to shift gears slightly here to touch on our last topic of the day, and in many ways it expands in some of the things that we've already talked about, but with the focus in organizational resilience. Before we do that, I just wanted to introduce myself as a member of our UPMC ASAP staff support team and as a lead social worker here in the hospital. My primary responsibilities here are focused in our integrated health and aging program, which is specifically designed for consumers that have comorbid medical and mental health needs. And in many ways, the population of the people that we serve on the unit here in the hospital, including their age, their care needs, their vulnerabilities, are consistent with the residents that you're also serving in your long-term care settings. In my role here, I've had the opportunity to directly communicate and collaborate with many of the long-term care facilities in part of our discharge planning, and certainly we've received patients as well from some of these facilities. And so we understand firsthand the challenges and significant changes that you all have been facing in the day-to-day work with your residents and their families. And since this is the age group that's most at risk in the pandemic, we, including us here in the hospital, have had to significantly adjust how we deliver care to be more mindful and proactive in limiting COVID exposure and the impact, including our own exposure, and then that, of course, of our families. We also understand firsthand that it takes a village, from physicians, direct care staff, utilities management, maintenance, nursing staff, administration, activities programming, dietary, pharmacy, and I'm sure I'm forgetting disciplines in there as well, but all of us working together to meet our clients' needs and to keep our organizations operating successfully, even in a normal climate. And as individuals working in the health and human services field, we understand that this work is naturally stressful. And as a result of that, we've developed our UPMC CISM ASAP peer support program specifically to acknowledge and address this within our workplace here at Western Psychiatric Hospital and UPMC wide. As a group, we often talk about the importance of resiliency. We understand that resiliency is the capacity really to recover from difficulties. And generally, when we're talking about resiliency, we focus on the individual oftentimes. We also generally focus on how to build reserves before a crisis. It's important to note, though, that resiliency is also developed when we are exposed to and when we're overcoming stress. And in many ways, you've already created the reserves that you need to deal with some of the stress. That being said, as we know, we're dealing with an event now in the pandemic that's expanded beyond what we originally expected, both in length of time and overall impact. And you guys know this firsthand, and probably more so than any other population in the community right now. And as a result, the reserves that we've built are close to, or at this point, maybe completely depleted. Yet we're expected still to model wellness and to continue to serve our clients with poise and excellence, and this can be very challenging. We've talked today already about individual resilience and the importance of personal self-care by reviewing the individual stress reactions, coping and wellness tools, and providing resources for more support. And being mindful of individual impact, we know that it's important to also feel supported by your institution. And before we discuss tools for how your organizations can support individuals, we also want to acknowledge that catastrophic events like the pandemic also impact the larger group and the organization as a whole. So we're going to take a step further now to just talk about organizational resilience. I'm going to define organizational resilience and discuss why it matters. And then I'm going to turn it over to my colleague Jackie Lyde, who's our lead chaplain and also a member of our ASAP support team, who's going to provide examples of how an organization and leadership within the organization can support staff and create that positive work environment. So what is organizational resilience? It's the ability to sustain success and a competitive advantage. And an organization can do this by delivering excellent performance and care and adapting to change. Like the development of individual resiliency, an organization needs to work on strategies to achieve resiliency before, during, and after a crisis. So why is this important for us? For an organization to be successful and sustainable, it needs to focus energy in the areas then that will promote this success. And there are lots of ways that this can be done. For today, however, we're going to emphasize the importance of how to invest this time into supporting employees and staff who significantly contribute to an organization's success. I'm going to tag Jackie in here, but I need just one more second to review. And I'm sorry, I'm going to ask Jackie here to review some strategies for how to support staff, how to foster employee wellness, and promote solidarity, especially during a pandemic like COVID-19 or any other catastrophic event. But before I do that, just two additional thoughts. The first thing is just keep in mind that the tools Jackie is going to review with you today can be applied to individual support, whether that's peer-to-peer or by organizational leadership. And it also can be applied to how to support a group. And I really encourage everybody to be reflective of these tools and how they can be implemented into your organization immediately or built into your organization's strategic plan. And final thing I'll say before I pass it on to Jackie is just thank you all for the hard work, for your dedication, for your commitment to the residents. We know how hard it is out there. We just want to take a moment to recognize you and appreciate everything that you're doing. Jackie.
Thank you, Abby. As Abby said, I am Jackie Lyde. I'm the lead chaplain of pastoral and spiritual care at UPMC Western Psychiatric Hospital, as well as a member of the ASAP Critical Incident Stress Management team. And we realize that this is a challenging time and many things are out of our control. But one thing we do know that is in our control is the way how we respond to situations. And so we're going to talk to you a little bit about how to support staff during COVID-19. Supporting your staff is a crucial step in obtaining organizational resilience. Support can be provided by both peers and leadership. However, it is imperative that leadership take an active role in providing support, especially in the setting of COVID-19, with a focus on managing the acute change stressor and an emphasis on staff value. Being self-reflective is very important. If you're not able to support a staff member because of your own stress or personal challenges, then recognizing that and delegating to another person can just be as important. Some of the stress reactions that you may see are people leaving early, frequent call-offs, tardiness to work, change in personality or physical appearance, short temper or irritability, social isolation. This is a time where we really need to support staff, and we need to plan for some downtime, even in the midst of people calling out, because the people that are here that are caring for our staff, they need a break too. And so we want to build in some time to relieve stress, even if it's just sending out an email, saying thank you, or having a 5-minute meditation, a 5-minute yoga. You want to incorporate something to go along with these stress that people are having. And you want to give them the opportunity to express it in a non-judgmental environment. Strategies and tools for supporting individual staff members. Be present, available, and transparent. Acknowledge their experience. Listen proactively. Validate their experience by providing recognition, acceptance, and encouragement, remembering that validation equals value. Start with a yes and identify a positive. Remind why we do the work that we do, to motivate and encourage. Refocus on organizational values and goals of care. Allow for self-reflection and processing. Encourage the individual to identify personal coping strategies. Encourage the individual to identify and name a support person outside of the work setting. Encourage and provide opportunity for peer support. Promote self-compassion. And promote spirituality and religion. As some people turn away from their faith during this time, there are also those who turn towards their faith. And allowing them that opportunity to express that faith is essential. We have to make sure that we celebrate every win, that we're not just communicating what is happening and what is negative, but that we're also communicating the positive, how we have been successful. Strategies and tools to promote solidarity are identifying champions of care. People in each area that will care for their coworkers and are willing to promote activities that will help them to relax. Focus on transparency and accessibility in leadership. Set clear and attainable expectations. Allow for growth opportunities. Offer opportunities for social gatherings as a way to decompress and build rapport. There's amazing things that you can do on Zoom and Team that you can still have a social gathering. So when you're considering how you're going to do your holiday parties and things like that, consider not just canceling them, but doing them visually. Offer opportunities for peer support. Promote and support spirituality and religious practices. Acknowledge and value diversity and individuality. Your organizations are the ones that's making the biggest difference during this most stressful time in our country. Your employees are making a difference. You are making a difference. Thank you for all that you do. At this time, I will turn it back over to April Kane.
Thank you very much. I'd like to thank all of our presenters today, participants from the Allegheny County Health Department, as well as all the presenters from my partners here at UPMC at Western Psychiatric Hospital for their time at presenting this most valuable information. I'd like to also thank all of you, the facilities that have decided to participate and listen here today. I think all of us realize the stress and strain that COVID-19 has placed on our country as a whole. But however, all of you on the front lines caring for our most vulnerable individuals in the settings that you're in, the supports that we can provide for infection control and PPE needs, all of those tangible things are very important. However, also making sure that we're taking time to address our mental health and how we are coping and how your peers are doing and holding up is very, very important. I would encourage all of you to take use of the valuable resources that have been shared here today. And I know that when our various teams are on site, whether it is our AHN colleagues or my team members from UPMC, when we do go out to facilities, we do share various behavioral health and mental health resources that are available to support you at this time. I also just want to remind all of you that we do have a 24-hour call center that is available. UPMC's call center for our Regional Response Health Collaborative is 412-648-6714. And the AHN call center is 866-496-1766. Now, if you're not sure who your primary representative is, if it's UPMC or AHN, that's fine. If you call either of the numbers, we will make sure that the right team or resources reach you for support during this time. So again, I just want to thank everybody, and I hope all of you have a very good weekend, and we all can take stock and be thankful at upcoming Thanksgiving next week, and just take stock of the gratitude that you have for your staff and your peers that are in this with you every single day. You're all doing a wonderful job, and hopefully we're able to provide some additional supports and resources to you here today. Thank you.